All right, next we're going to be talking about chronic venous insufficiency. So we talked about the arterial problems. Now we're going to talk about the same type of problem, but in the venous system. So this one is about inadequate venous return over a prolonged period of time. And it's really important to start identifying like varicose veins as part of this chronic venous insufficiency kind of presentation. The other reason that patients can develop this is valvular kind of dysfunction. So the valves inside of a patient's veins that prevent backflow of blood can become dysfunctional and allow that blood to pool and backflow rather than just go in one direction back towards the heart for venous return. So looking at our assessment data. So for recognizing cues, this is a problem of the vascular system. Fair? It's a chronic venous insufficiency, vascular system, same thing. The other system that we want to pay attention to is the skin, because this is really going to be the result of poor circulation. Poor in this case, meaning an excessive supply of volume being left available to the lower extremities. So the specific symptoms we're going to be looking for are things like edema. These patients may have diminished pedal pulses as well. And that's not because they have arterial flow problems, because remember our pulses are always, we're just palpating arterial blood flow. These patients are going to have diminished pedal pulses because of the edema. So that extra fluid is actually obscuring our ability to palpate their pedal pulse, not actually impairing it. These patients may also have erythema, so swelling and redness in particular, and pruritus, which is that itchy skin. As the skin stretches from the edema, it can get very itchy, very uncomfortable. Think about how your legs feel like after a long airplane flight or a long car trip where you've been sitting for a long time, they get kind of itchy and restless. So that pruritus is a big symptom that patients do experience with venous insufficiency as well. They also tend to have this staining of the skin, the hemosiderin staining. So if we take a look at our chronic venous insufficiency pictures here, so this brown staining, that's what the hemosiderin staining looks like. And it's very pronounced in patients with chronic venous insufficiency. And these people are also going to have wounds associated with this flow problem, but their wounds are very, very, very different looking. They do not have punch wounds like peripheral artery disease. These patients have larger, very irregular shaped wounds and very wet wounds because underneath that wound bed is edematous tissue. So there's a lot of moisture coming out of these wounds as well. They also tend to be from between the ankle and the calf. So kind of in the lower part of the leg, not necessarily on the foot. For prioritizing hypotheses, on the medical side, it's all about our physical exam. So we want to appreciate the edema and measure it as best we can with palpation. So +1, 2, 3, 4, edema, that kind of a thing. And we want to evaluate like what's the reason that this patient has peripheral chronic venous insufficiency, excuse me. Is it because of varicose veins? Is it because of valvular dysfunction? Or is it because volume status? They have too much circulating fluid volume. We really do need to address the source in order to address the symptoms that patients are complaining of. As far as imaging goes, we can do a couple different things. We can do a venogram, which is an image of the vessels, and we can look for tortuous and engorged veins in the lower extremities, or we can do CT scans. So this image over here is a picture of a 3D CT scan. So it's a very high-tech CT scan that can be done. And you can see these arrows are pointing at this very engorged vein. And when they're all twisty like this, kind of going all over the place, we call that tortuous. So this is a very tortuous and engorged vein on somebody's lower extremity. On the nursing side, ineffective peripheral tissue perfusion is a big thing that patients will either have or be at risk for. If they have a wound, they most likely have it. If they don't have the wound and maybe their edema is under control, maybe they're at risk for it. Activity intolerance also goes along with the edema that patients may be experiencing. The larger and more swollen your legs get, the less likely patients are to want to move around or to feel like to not feel pain while moving around, because the larger their legs get, the more pain they're likely to experience. So we do want to assess for pain as well. Then for risk management, we're really concerned about their risk for infection because of those open wounds. Just like peripheral artery disease, these patients have very, very poor circulation in their legs, meaning that there's not a great way for white blood cells to come in or for enough protein to get into those wound beds in order to cause tissue regeneration. So these wounds are going to be open for a long period of time, and it's going to be really tough for them to close, meaning that the patient is more likely to develop an infection because they have an open wound for a longer period of time. When we look at the solutions we need to generate, so on the medical side, improve venous return. So the big thing they want to do is reduce edema. This can mean fluid volume stuff. So we may see these patients on diuretics. We may also see these patients doing other kind of supportive therapies with like physical therapy, so like elevating their legs, things like that. Wound care is also another big priority for patients with chronic venous insufficiency. These patients, it is very, very difficult to heal their wounds. When I was a wound care nurse, like I dealt with these wounds, and they often took years to heal because of all the moisture that was produced. When the wounds get really wet, they tend to get much larger very quickly. So these are wounds that can go from like the size of a quarter to like the size of your hand in about 36 hours. They can get really, really big, really, really fast. And they're very difficult to close because they continue to weep fluid from the edema that's underneath them. So this is another great time to call in our wound care nurses because they are going to be a great resource on how to provide dressings that are going to absorb a lot of that fluid and help with wound healing. So on the nursing side, we are going to primarily focus on symptom support. So we can achieve this by helping with the edema, right? The edema is what's going to cause pain for our patients. So we want to try and address that. And we can do that by using interventions like compression. So TED hose are a great tool to use for patients with chronic venous insufficiency. And also activity. So again, this is like broken record time now. Promote independence for these patients and provide adaptive equipment. It may be really painful because of the edema for them to put weight on their foot and on their leg. So these are great candidates for perhaps some adaptive equipment, maybe some walkers, tools like that from physical therapy that may help to promote more independence rather than more sedentary lifestyle. These specific actions that we want to take with these patients. So here's a great example of their wound. Let's just address the gross picture in the corner first. You can see the staining on this patient's leg, and right in the middle of that staining is their wound. It is large, it's very irregular shaped. This is what a venous insufficiency ulcer really looks like. And the big thing we want to do in order to help this wound to heal, and this patient actually is a great example of this, is manage their edema. This patient, you can very clearly see kind of the outline of their ankle and their heel on their leg. When patients have severe edema, it's just like tree trunk on top of a foot. There's no ankle, there's no heel structure. It's just big tree trunk, just giant leg. Yeah. So these patients, we can do compression stockings on. So TED hose are a great option if we can get them on. It can be really challenging when these patients have very high levels of edema in their legs. When they do, we want to actually use ACE wraps. And we're going to wrap those starting at the foot and working our way up the leg to help promote some of that venous return up the leg and back into circulation. These things are going to both, regardless of which one we use, either TED hose or ACE wraps, they're going to help promote blood return, prevent pooling in those varicose veins or some of those engorged vessels. Other tools that we can help with the edema is elevating lower extremities. So we want to tell patients and help them come up with a prescribed schedule of kind of elevating their legs for a half hour, lowering them for 15 minutes, elevate them, lower them, that off and on kind of pattern. That way they don't get into a habit of being very sedentary with their legs elevated all the time, but they still are able to do their ADLs, to get up, move around, and kind of participate in normal life events. Wound care, as we kind of mentioned, these are very, very wet wounds, meaning there's going to be very frequent dressing changes. I highly recommend consulting wound care nurses when you guys are dealing with chronic venous insufficiency wounds, because they do very, very often require specialists to manage them and specialty wound care products to control the amount of moisture coming out of them. And then for activity, we want to reduce edema prior to major activity. So this is kind of talking to patients about that, elevating their lower extremity kind of planning, so that they're ready for what activity is ahead of them. So it may mean that they elevate their legs for, say, an hour before they go out to the grocery store to help reduce their edema, knowing that when they're in that standing position while they're doing their shopping, their edema will probably get a little bit worse than it would be if they were continuing to elevate their legs. So we do want to help them kind of reduce the edema that they're experiencing and the discomfort that goes along with that. These patients are going to have, well, let me rephrase this. Sorry, I'm going the wrong direction. When we talk about major activity, most people don't consider going to the grocery store to be major activity. But for patients with chronic venous insufficiency, that is a big activity. It's going to take a lot of effort. They're going to have to tolerate quite a bit of pain in order to achieve it. So we do want to really be cognizant of just those like secondary ADLs. That can be major activity for a patient with chronic venous insufficiency. So for the evaluation, first question we got to ask ourselves is, are they feeling better? Have we reduced their edema? Have we gotten that down to a level that's not causing them as much pain, as much discomfort, as much limitation to their normal ADLs? So what kind of compression application is working for them? So on the top picture, we can see a great example of like the ACE wrap type of compression, so that we're really pushing that blood flow back up the leg. And on the bottom, we can see TED hose. And the other great thing about these TED hose is that this patient's using some occupational therapy equipment to help to get those TED hose on independently. So patients may and probably will progress from the ACE wraps when their edema is really severe to TED hose once we've gotten their edema much more managed. And then wound care. Dressing changes. We want to make sure that there's a good plan for dressing changes. We know the frequency of dressing changes and that the appropriate wrap is on top of their dressing change. So most of the time, if patients have very large ulcerations or wounds because of chronic venous insufficiency, we're going to be doing the ACE wraps, not the TED hose, because the TED hose can cause shearing forces, which can make their wounds actually a little bit worse. And most of the management is going to be outpatient. So anything that we are doing for these patients, we want to make sure we're teaching them about so they can continue that practice in the outpatient setting in their home environment, and also be evaluating for their limitations. We all went through lab when we had to put TED hose on the mannequins. So if patients aren't able to do that for themselves, which, let's be real, a lot of people are not able to put TED hose on by themselves, we want to be consulting with occupational therapy in order to see what kind of tools or adaptive equipment might be available to help these patients put on those compression type interventions. Oh, sorry, I was about to hit stop, but we got one more slide. So just quick summary. Assessment. We need to differentiate venous insufficiency from arterial insufficiency. So we want to be looking at their skin. Skin's going to look very different. They're going to have that staining. There's going to be redness. There can be heat, itching, edematous skin, and the wounds are going to be very, very different. These patients with a venous insufficiency, they're going to have those very large, very wet, irregular shaped wounds. Goals of therapy, we want to manage the symptoms. We don't have a lot of curative therapy for chronic venous insufficiency, so symptom management, especially edema management, is really the name of the game. And teaching. Anything we are doing to help manage a patient's edema, we want to be teaching them so that they can continue that practice in the outpatient setting and prevent any complications of their disease, such as wounds. And prepare for outpatient. We kind of talked about that. They're going to need to do this stuff independently. So what kind of other resources or adaptive equipment may be helpful? There we go. That's venous insufficiency.